Good morning, everyone. Happy Tuesday. Welcome to our second Facebook Live event related to the COVID-19 pandemic. I'm John Parsons. I'm a professor here in the College of Medicine. I'm also a pulmonologist working here at Wexner Medical Center. Today, we're going to cover a few topics, and I want to make sure we have time at the end to answer questions. Yesterday, we had an onslaught of questions, and we couldn't get to that many of them, so hopefully we'll have some more time today to get to your questions. So please feel free, as I'm talking, to submit your questions on the feed, and we'll get to them at the end. Today, we're going to cover what you should do if you think you have COVID-19, what the symptoms and signs are of that infection, when you should worry and escalate your care to the emergency department or the hospital, and then how can you keep your family safe if you're quarantined at home with COVID-19. So we talked about this yesterday. The symptoms of COVID-19 are very nonspecific. There's no one symptom that says, yes, that makes sure for sure that you have COVID-19. But the most common ones are fever, dry cough, shortness of breath, and body aches. Now that sounds like the same symptoms you might have with influenza or other bad viral infections, and that's correct. When should you worry about these symptoms? A couple of signs that you should pay attention to. One is if you've got progressive shortness of breath that's getting worse and you're finding it more difficult to breathe. If you have altered mental status or confusion or chest pain, that is worrisome for an acute coronary syndrome or myocardial infarction, simply called a heart attack, you should go to the emergency department in those situations. I would ask that if you were to go to the ER, that you call ahead and let them know that you suspect that you may have COVID-19, and they may meet you upon arrival, get you masked and isolated from the other patients in the waiting room. So let's say you think you have COVID-19. What should you do? Well, the first thing, as I mentioned, don't go to the ER. Don't go directly to urgent care. First thing you should do is call your doctor. And he or she will give you guidance about whether or not they think that you need to be escalated to a higher level of care or whether you can ride this out at home. The vast majority of patients, as I mentioned yesterday, about 80% of patients are going to be able to ride this out at home and will have a self-limited illness over a few days. Let's say you decide to ride it out at home. What should you do? Well, what we're asking people to do is to what we call do home isolation. Now, that's different than being quarantined. Quarantine means you just stay in your house and you're free to roam from room to room and interact with your family. Home isolation is you find a space that is only for you, a sick room, so to speak, and you stay in that room during the duration of your illness with minimal contact with your family until you're symptom-free. So that's difficult to do, obviously, especially if you've got small children. But nonetheless, that is a strategy at home that is critical for us to keep our family safe from also getting infected. Clearly, we don't want to share personal items, cups, forks, toothbrushes, razors. We don't want any of that common use. Towels are another example. Clearly, you want to wash your hands as much as possible. Soap and water is just fine. What I would like to talk to you about is how to properly wash your hands. Just rubbing your hands together like this is not sufficient. I want you to pretend like you're a surgeon scrubbing into a case. You need to get between your fingers and do the backs of your hands as well for roughly 20 to 30 seconds. Hand sanitizer works well too. One key feature, a lot of people are starting to make their own hand sanitizer. For a hand sanitizer to be active or efficient, it needs to have either 60% ethanol or 70% isopropyl alcohol. If it's below that, it's not 99% germicidal. So when you go to the store, if you can find hand sanitizer at the store, look on the labels to make sure that they have those appropriate levels of disinfectant. You want to wipe down personal items. You want to wipe down those common items I talked about yesterday, remote controls, bathroom fixtures, telephones, etc. Clean as much as you can and stay away from your family as much as you can. When can you come out of home isolation if you're doing this at home? Well, three things have to happen. One is you have to be without a fever for 72 hours without using any ibuprofen or acetaminophen. You have to be improving in terms of your symptoms. And 7 days have to have passed before, from your first symptom to the date you want to DC or discontinue isolation. So those three things, if those are all true, then you can come out of the home isolation. One caveat is that your family will need to be quarantined for 14 days from the onset of your symptoms. Even if you come out of isolation, your family needs to be quarantined for 14 days from the onset of your symptoms. I think I've covered what I wanted to cover in terms of the content today. I did want to address a couple of questions that I got frequently yesterday that I wasn't able to get to. Lots of viewers asked about their pets. There's no evidence that you can give COVID-19 to your pets, your dogs or cats or whatever. And there's no evidence that your dogs or cats can carry the virus on their fur or skin and transmit it to your other family members. So it's free for you to interact with your pets if you're in quarantine or isolation. I also got a lot of questions about ibuprofen. So this is a complicated story, but there was essentially a letter to the editor that was published in a very prestigious European medical journal that warned that there could be an association or a worsening of COVID-19 with ibuprofen use. There is no randomized clinical data supporting that. And the World Health Organization has come out with a statement stating that it's perfectly fine and safe to use ibuprofen during COVID-19 illness. So feel free to use the ibuprofen products in appropriate dosages, of course. And then the other issue I was asked a bunch about was this hydrochloroquine, chloroquine, azithromycin story that you're hearing a lot about. That data comes from a very small European study as well with very few patients in it. It was underpowered and had some methodologic flaws in the study design. So there is no randomized clinical data supporting the use of hydroxychloroquine, chloroquine, or azithromycin to treat COVID-19. I think you've heard Dr. Fauci say that many times from the White House. What I would advise you is not to hoard these medications as a safeguard. We're having patients who have autoimmune conditions that need these medicines to treat their known diagnoses that are having a hard time finding these prescriptions at grocery stores and pharmacies. So at this point in time, we do not recommend those as empiric treatment for COVID-19. And with that, I'm going to go ahead and look to see what we have in terms of questions on our feed today. I have a lot of shout outs saying hello and thank you, but I want to see some questions here. Question, if you have no fever, but shortness of breath and sore throat, do you still need to be isolated? That's a judgment call. As I mentioned before, there is no specific grocery list of symptoms that makes you definitively have COVID-19. I would say that sore throat and shortness of breath are common symptoms that we see in COVID-19. And discretion is a better part of valor. I would isolate in that situation. Good question. Should healthcare workers stay somewhere away from their families? Well, I'm a healthcare worker. My wife is a healthcare worker. Our strategy when we get home is in our laundry room, I basically take my clothes off, throw them in the laundry, and immediately go into the shower without touching anybody. We have a space in our mudroom where I put my wallet, my cell phone, my earphones, anything that could potentially have any kind of viral particles on it, and I keep them away from the general house or the kitchen. And we've done well with that. And I think that's a good strategy. I do not think you need to isolate totally geographically from your family if you're in the healthcare field, but a little extra precaution is probably indicated. Sorry, there's a lot of questions here. A lot of comments here. I'm looking for some good questions. Some people say if you have had pneumonia, you are at risk to get this. That's not necessarily true. So none of us have any innate immunity to this virus. So whether or not you've had pneumonia in the past doesn't really affect your ability to acquire this virus. I will say, as I mentioned yesterday, that if you have a comorbid underlying chronic medical condition, asthma, COPD, heart disease, that would make you at increased risk for complications, but it doesn't really affect your risk of acquiring the virus in the first place. You guys are giving me a lot of shout outs here. I'm looking for good questions. Good question. How long can COVID-19 live on surfaces like paper, cardboard, metal, clothes? Do you think takeout food is safe? Well, I mentioned about the takeout food yesterday. I think it is safe. We just had takeout at our house last night. As far as the virus living on surfaces, there's actually a study that was done in the New England Journal of Medicine that was published not long ago that compared how long can the virus live on different surfaces? They compared aluminum, copper, plastic, cardboard. And what they found is that it can live for several hours on aluminum and plastic. It's not very viable on cardboard or clothing. So I think if you took some precautions at home, as I mentioned before, wipe down your common surfaces as much as possible. But if you get a box from the mailman that's cardboard, you're probably safe without wiping it down, because the virus doesn't live on cardboard very well. There are things going on around Facebook indicating that if you drink hot liquids, it will kill the virus in your throat. Is this a myth? There is no evidence that drinking hot liquids will kill this virus. Remember, this is a respiratory virus. So this virus gets into your nose and then into your lungs. And when we swallow hot liquids, there's no contact with our nose or our lungs. It's going down your esophagus into your stomach. So there's no evidence that that would be a treatment strategy. If you get I think we talked about this yesterday, but we'll go through it again. If you get the virus once, can you get it again? We don't know the answer to that question. This virus is novel. We don't have enough information. We're looking at collecting the serum, the plasma from patients that have been infected, and seeing if we can boost immunity in those that aren't infected yet. That's called convalescent serum. Those are studies going on right now looking at that, but we just don't know the answer to that at this point in time. My 83-year-old mother is on celebrex daily. Is that NSAID a concern? Like I mentioned before, there is no evidence that the non-steroidal medications are going to increase your risk of complications from coronavirus. The World Health Organization came out with that statement not long ago. So if there's an indication for these medicines for another medical problem, there's no reason not to take it for that problem because of the COVID-19 epidemic. Do you think it's possible that at the end of January, my flu-like symptoms were indeed COVID-19 with all the flu shots and I never get sick? It's certainly possible. There's no way to prove it definitively. The only way to even look at that question would be if we drew your blood to see if you've got antibodies to the coronavirus in your system. And if you did, that would indicate that you've had a prior infection with this virus. Question, steroid dependent here. Reading steroids, especially prednisone, are actually shown to be harmful in the treatment of COVID-19. So we don't know if steroid treatment helps reduce the acute lung injury from COVID-19 that I discussed yesterday. What I will say is that if you're on chronic oral steroids, your immune system is depressed. So that does make you more susceptible to acquiring the virus and having complications based on the immunosuppression from the prednisone. It's allergy season. Would you qualify a scratchy throat or rhinitis as a concern? People seem concerned this is part of the virus. No fever accompanying those symptoms. So we are in allergy season. As you've probably seen, things are greening up outside. The grass is greener and the trees are starting to show some buds on them. So if you have chronic allergies and your symptoms of nasal congestion and scratchy throat are there, but you don't have a fever, it's unlikely you have coronavirus. Fever is a very common symptom in COVID-19, and it's unlikely you have systemic infection that's tangible without a fever. So it's probably just your allergies. What is a good, accurate source of COVID information and updates? Well, I think tomorrow we're going to have another Facebook Live event where they're going to talk about resources to go to, reference points for information. You can never go wrong by going to the Ohio Department of Health or the CDC websites to give you accurate information. Just as a plug, as a personal opinion, if you listen to Dr. Fauci and Dr. Acton, you're going to get the best information you have available to you. Why are they not saying what part of a county where most cases are? So we have information. We have COVID positivity broken down by county in the state of Ohio. We know exactly how many patients are positive in each county in the state. So Whether or not that's proprietary information to healthcare providers or to administrators or leaders, I'm not sure, but that information is widely available to us. I think we'll have one more question. When is the predicted surge of patients with COVID expected in Ohio? Great question. We have a lot of smart people working on this, mathematicians and public health experts. You know, our expectation is that we expect the surge in Ohio to happen in mid to late April to first week in May. I can tell you here at Ohio State, we have spent 24/7 preparing for this, and we have a plan for space, personnel, and personal protective equipment that we feel is adequate enough to take care of up to 2,000 patients. So when I'm not doing Facebook Live, that's my job currently, is to prepare the Department of Internal Medicine and OSU WexMed for this endemic event that's likely to come in the next few weeks. And with that, I'll stop and thank you for listening, and hope everyone has a happy Tuesday. Please tune in tomorrow. I apologize, I don't know what time the event is tomorrow, but please look on the webpage and there'll be information there. And have a great day. Thanks a lot.